If your doctor has mentioned a Whipple procedure, here is a clear look at what it actually involves. The Whipple, or Pancreaticoduodenectomy, removes the head of the pancreas, along with several closely connected organs. Along with the pancreatic head, surgeons remove the duodenum, gallbladder, lower bile duct, and nearby lymph nodes. It is used mainly for cancers of the pancreatic head, bile duct, ampulla or duodenum, and some non-cancerous tumors. Before surgery, imaging classifies tumors as resectable, borderline, locally advanced, or metastatic, guiding whether surgery is possible. In many cases, guidelines now favor chemotherapy before surgery to shrink the tumor and treat any microscopic spread early. The operation takes 6 to 10 hours under general anesthesia. Surgeons first remove the diseased organs, then rebuild the digestive tract. Reconstruction reconnects the remaining pancreas, bile duct, and stomach to the small intestine so digestion can continue. The Whipple can be performed open, laparoscopically, or robotically. The best approach depends on the tumor and surgical team. Most patients stay in hospital 10 to 14 days with early walking, breathing exercises, and gradual return to eating. At home, light activities resume within days, while heavy lifting is usually avoided for 4 weeks. Risks include stroke, bleeding, temporary nerve changes affecting speech or swallowing, and rarely heart complication. Initial recovery takes 2 to 3 months. Chemotherapy after surgery is often recommended to reduce the risk of recurrence. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.